Marhaba, and welcome to the Matrix Green Pill, where real people connect.
Hello and welcome back to the Matrix Green Pill podcast. I'm Hilmarie Hutchison, and today I am again joined by my lovely co-host, Shirin. Welcome, Shirin.
Hello, Hilmarie. I'm so excited to introduce to you our very knowledgeable guest, Dr. Sawsan Al Madhi. She is the Director General for Friends of Cancer Patients and has more than 18 years of progressive leadership skills and experience for profit charitable sector.
Wow, I'm so excited to have Dr. Sawsan on today. Welcome, Dr. Sawsan, and thank you so much for joining us.
Thank you. It's a pleasure.
So to start off, could you please introduce yourself to our audience and give us a bit of background of your journey and how you ended up here in the UAE?
So my name is Dr. Sawsan Al Madhi, and I'm the Director General of Friends of Cancer Patients. I'm also an MD doctor, and also I have a master's in healthcare management. I was born in United Arab Emirates and proud to live all my life in the United Arab Emirates. Part of my journey is actually being involved with the nonprofit organization and sector in United Arab Emirates. And I have been involved with Friends of Cancer Patients since almost now 18 years. Started as a volunteer, and I'm blessed to be able to help and associate grow this entity with the amazing team, but also with the directive of our esteemed board member. So yes, it has been a journey, but it has been an amazing journey. I'm always every day grateful and in awe, and also anticipating the amazing thing that's going to come ahead.
Fantastic. So your family are all based in the UAE with you?
Yes, I am pleased to be based with my family. I live with my mother, my two brothers, and I have a sister who lives abroad, actually in Germany, who is also a doctor. So this is why before I did mention that don't call me Dr. Al Madhi, because there's 3 Dr. Al Madhi in my family. It's easy to just say it's my late father was a doctor and my sister and myself.
And were you all in the same field as doctors or in different fields?
Yes, so my late father was an orthopedic surgeon, and he was from the pioneers who were in United Arab Emirates, who laid the foundation for the healthcare sector here. He used to work, and my father came here in 1969 with my mother. And just before the United Arab Emirates became United Arab Emirates, and they laid the foundation for the healthcare sector. My mother is a lawyer by education and an educator by profession. She had vast amount of experience in also laying the foundation for the educational system in United Arab Emirates.
Wow, what a smart family, doctors and lawyers. That's brilliant. Can you tell our audience a little bit about Friends of Cancer Patients? What is that about?
So Friends of Cancer Patients is a charitable organization that was founded in 1999, so almost now 23 years since its foundation. And it was founded with the vision of Her Highness Sheikh Jawahir bin Mohammed Al Qasimi, the wife of the ruler of Sharjah, who envisioned an organization that can help and support cancer families and patients, but also be a beacon of hope for the community to raise awareness about cancer and how to prevent cancer, if that's in the also early screening and detection of cancer. So the organization was founded on these pillars, which we still actually work on. Plus, of course, we do a lot of advocacy to make sure that policymakers do actually put the need of cancer patients on the top of their priority list. And we are happy to be part of many committees in the UAE where we shape the cancer control plan of the nation, but also make sure that the voice of the patient is well heard. So what really Friends of Cancer Patient does is we are, as our name says, we actually are friends to the cancer patient, but also their family. And we try to provide the financial and moral and psychological support and network for the patients and also their families. And we try to emphasize that cancer is not the end of the road or the journey, but if anything, we have lots of success stories where patients actually battled their cancer, beaten their cancer, and living amazing lives right now. We have done a lot, I believe, throughout the years, and I believe we still have a lot to do. Main things that we also focus on is educating the community. We focus a lot on health literacy because we believe that is important. So it's not just educating the community about the disease aspect, which is the cancer, but also how to stay healthy. And I believe it's so important right now, especially after the pandemic and after what's happened with COVID. I believe everybody's just fed up of hearing about disease. I think people want to hear about how can I stay healthy? How can I maintain my health? And and how to, if there is any preventive measures that I can use to keep myself healthy on lots of level, not just on the cancer level. And I think that's what we're focusing on right now. We have created our YouTube channel, relaunched it with new themes and new ideas about wellness and lifestyle that incorporate the definition of health, which is according to the WHO, who I'm sure everybody knows what is the WHO by now, the World Health Organization. They defined health in 1946, which is almost a decade ago, as it's not merely the absence of disease, but it is the complete well-being from a physical, mental, psychological, environmental, and social aspect. So we try to incorporate all these elements to try to give a holistic approach to how a person and a community and a nation can actually stay truly healthy to that definition.
You do so much. I can't even imagine how much your role holds, how much responsibility you have. Do you think you could maybe give us a brief about what it means to be the Director General of Friends of Cancer Patients?
It's an interesting question because I don't see myself as the Director General of Friends of Cancer Patients. I just see myself as a person who offers support and help to the team, offer my expertise as well, offer my knowledge, and make sure that all of us are working together towards a common objective and goal, which is at the end of the day is the cancer patient, and how we can save one life, but also make other cancer patient life more easy. And really, we're talking about quality of life at the end of the day. We want cancer patient to live their life at the fullest and enjoy every moment of it. Sometimes I don't really see myself as that Director General, whatever that connotation holds, but all that I can say is I'm very honored and grateful to have an amazing team behind me, beside me, in front of me, supporting me, and I'm supporting them. And again, with an amazing board of directors who their vision and their hard work is really supporting us night and day. And we are very grateful for that. So at the end of the day, a position of leadership is not about the leader himself or herself, but it's about how can you help others. And again, I'm very grateful to be in that position, to be able to help others and in the process help myself as well. I learn a lot on a daily basis, and I believe if each one of us try to learn at least one thing at a day, that would be amazing. We should not stop learning and take each and every opportunity around us to learn.
Absolutely. I completely agree with you on that first of all, it's never too late to start learning something new, and that we should continue to learn something every single day. Actually, my next question was going to be more about the initiatives that you have organized over the years in relation to the prevention and the treatment of breast cancer. Can you tell us more about the Pink Caravan initiative? What is it and how does it work?
Yeah, that's a great question. And I think just before going and answering that, just want to highlight that Friends of Cancer Patient, when we are helping cancer patient, we help the patient regardless of what disease they have, as long as they have cancer. So it doesn't matter if it's breast cancer, lung cancer, colon cancer. It doesn't matter if that's a female or a male or even a child, because we help children as well. So from a patient perspective or access to their treatment, it doesn't matter what type of cancer. When it comes to educating the community and advocating about certain diseases, we focus about certain diseases just because diseases like breast cancer, cervical cancer in women, prostate testicular in men, skin cancer, colon cancer, and also childhood cancer. All these cancers do have screening programs and methods that we can educate the community about, and how to get themselves screened, what age is appropriate age, how to do that, where to do that. So when we talk to the community about the awareness and education, we focus on the screenable cancers, which one of them is breast cancer. And of course, the flagship campaign is the Pink Caravan. Now, everybody knows the Pink Caravan, and we're so happy and grateful that during the last decade, Pink Caravan did get all that momentum. But people don't know that before the Pink Caravan, Friends of Cancer Patient used to do a lot on breast cancer awareness, just because most of the cases we used to see and still are actually breast cancer patients. And we used to do a lot grassroots, very intense awareness campaign inside schools, inside universities. And we used to target lots of young women as well, girls in the high school and university, because we believe that if at that age, age, the woman took upon herself that she needs to examine herself every month and do the monthly exam and do the clinical exam with the doctor every year. And as when she hits 40, she is going to definitely do the mammogram as well and continue with that habit on a monthly, yearly, and of course, the mammogram basis. So we did a lot before the Pink Caravan. And of course, when the Pink Caravan came, the idea was so amazing and it really engaged the whole community. It did engage lots of different sectors in the community. And I think that's why the Pink Caravan became the success it is. And because it was a community-based initiative focused on the community, for the community and by the community, because we had lots of volunteers from lots of different community sectors as well. Also with Pink Caravan, I think the novel thing that Pink Caravan introduced was speaking about breast cancer outside the Pink October, where before everybody used to speak about breast cancer only in October. And I think that is a culture in a way that Pink Caravan was against, because when Pink Caravan was launched, it was always, as a ride with the horseback riding. It was always during either February, March, or April. So mostly February and March every year. And as you can see, those 2 months are not related to Pink October. And I think maybe that's the most fundamental message that Pink Caravan provided to the community, is that breast cancer is a curable disease if screened early. Pink Caravan provides medical support, provides clinical screening, it provides the mammogram, it provides free access for screening, and it speaks about breast cancer, but it tries to highlight the topic and speaks about it the whole year long. It's not just October. So I think that's fundamentally what was the main reason why I think Pink Caravan in a way created its own narrative outside the Pink October. Because when you look at Pink October, and we are now in October, you can see, we have just finished October, you can see how tremendous the amount of events and activity that is done. Really, Pink Caravan created its own path and its own narrative in a way that we should speak about this the whole year. Let's talk about the myths about breast cancer and cancer in general. But most importantly, we have provided access to the screening, which was actually very crucial for lots of women who could not access a mammogram or get screened for early detecting of breast cancer.
So given that many people do not know what it is, what are the main tests or screening that should be performed to discover a possible form of breast cancer or cancer in general?
Bear in mind that when Friends of Cancer Patient, when we started speaking about breast cancer, that was almost 18 years ago. Even the word breast cancer or cancer, it was very difficult to be within a community. Either it's like a school, you're lecturing, or you're in a university and actually speak, or even in any community setting where you are doing an awareness lecture where you can actually speak about the word. I mean, it was really very hard. The community at that time didn't want to understand or didn't want to accept the word itself because of all the bad connotation that is linked to it. So definitely from that point of time till now, we came a long way, but still there is lots of misconception about and misinformation about breast cancer, to be specific, and cancer in general. And I believe the most important one is cancer is a fatal disease, or cancer is a death sentence. And I believe that's totally is wrong. And I think lots of people need to understand that, especially with breast cancer, early screening do guarantee cure completely and also guarantees a higher survival rate. And we have now great examples of women who discovered that they had breast cancer through the Pink Caravan, who went through the treatment journey. They're calling themselves survivors, which they are, and they are becoming a big advocate for other women to get screened. And we have amazing examples of these women. And to be honest, these women, the cancer itself, the breast cancer journey turned their life around. I can see them from just birth, as they say, they're not just survived the disease, they actually thrived for the disease. They became more open, they appreciate their life much more. They are really living life to the fullest, whatever that means to them. You can see the twinkle in their eye when they speak about their journey. An relatively easy disease to defeat if the woman got screened and discovered the disease early on. So these are some of the myths that people still have. The other myth, which is very important, is that breast cancer only happens to women and only affects women, which is totally wrong as well, because it does and it can affect men, but with a very lesser degree. So I'll give you an example. If you have 100 breast cancer cases, you will find that you will have 99 cases women and 1 man. And to be honest, we've seen it in Pinkeravan itself, where throughout the year we have managed to discover through our screening, we have screened over 80,000. We have discovered almost 81 cases. Out of them were 80 women and 1 is a man. So definitely that's one of the myths that now the community started to understand that's strong. And we do offer clinics and tests for men as well. There's also lots of information around if I have a family history, what does that mean to me? I need to do genetic testing, a screening, what does that mean to me? And we do address all these as well. And we try to educate the community about getting sound advice, because that's very important. I think obstacle for women is 2 things. This is not my opinion, but this is made from surveys, is that women will either say, I don't want to know, which is a fear-based statement. And we all know that as human being, which is goes to our natural defense mechanism, is that anything which is fear-based is usually because we don't know information about. Exactly, if you are in the dark room, if that room is a room that you know, even if the dark, you can navigate through that room. But if that room is a new room to you and you are kept there in the dark, you will never know how to navigate through that room. So again, it's very interesting because we need to shed, the only way to counter darkness is by light. And in this case, light is knowledge. You only need to know more about the disease. And the moment you see another woman who went through the journey and battled the cancer and won the battle, you understand that, you know what, I'm not afraid of that. I can do that. And to be honest, I need to take care of myself if I want to be the good mother, the good wife, the good daughter, etc. The other thing that a woman always reply is, the first one we spoke about is fear. I don't want to know. The other one is, I don't have time. And many women would say, yeah, sure, I'll book a mammogram, and then she'll cancel it because something urgent happened. And it's very important for us to be able to function, to be healthy. And to be healthy, we need to take care of ourselves. Doesn't matter when you do your routine checkup and mammogram, as long as you do it. Give yourself a priority and make sure that you are a priority, because again, if you want to help others, as women do, we always, think about other people and how we can help the family, make sure everybody's relaxed and happy and comfortable within our family circle. But that will not happen if I'm, as a woman, I'm not taking care of myself and I'm exhausted and stressed and don't feel that I'm healthy enough and always stressed. So do your mammogram and just take that stress away from your stressful lists, because the moment that result comes back and you go like, okay, I'm free, I'll do it in the next year or a couple of years according to the report, then that's off your to-do list. And I think we need to be kind to ourselves when it comes to taking care of ourselves. And I think we should be a little bit, I don't want to say selfish, but again, put ourselves as a priority in our priority list.
I think that is absolutely valuable advice, to not hide away, because fear, it just makes it worse. Rather go and have it done. Be sure that there is nothing to worry about. Then you can have a positive outlook, because you've either sorted out that there is nothing to worry about, or if there was something to worry about, you're catching it early. So I think that's having the mammogram is very important. Thank you for sharing that.
Thank you. Absolutely.
So I wanted to touch on supporting a family member or a friend who has cancer, and how important is it for patients and their friends or relatives to receive adequate psychological support to deal with this?
That's a really good question, because again, if you reflect on my earlier, when I quoted WHO definition when it comes to what is the definition of health, and it does mention the psychological well-being as well. So if you take a cancer patient who is ill from a physical point of view, so this patient, she or he having an issue inside his body, again, health, as we defined it before with the WHO definition, is not just the body, it's not just the physical, it's the physical, the mental, the psychological, the social, the environmental, I add even spiritual. So if you want to bring that person back to health again, you have to truly encompass the whole definition, the whole holistic approach to health. And part of it definitely would be the psychological support. And I would not recommend, just because psychologically, or the word psychological, it has again a lot of maybe negative behind it. Moral support is very important, I think, showing your your support to that person, either if that person is in your family or in your circle of friends, showing them the support as a cancer patient is really, really very important. Just saying, I'm there, I'm willing to listen to you, but also making sure that you understand what they need. I do hear a lot of people, sometimes the cancer patient, if she or he will come and they say, I'm offering support to my close circle more than they offer me, because they go into panic attack. They don't know what to do. They suddenly understand that their best friend or their brother or sister suddenly was diagnosed with cancer, and they don't go, okay, I don't know what to do. I don't know what to offer them. That will make them feel weird, and that will make them feel as if, something is wrong. That's based on my experience. The last thing any cancer patient wants is to feel awkward about what they had. We did say that cancer is, especially breast cancer, is very much curable. So it's just a phase. And I think we need to ask that patient, what do you need from us at that point? Maybe it's nothing. Maybe just be there for me. Maybe it's just take me to my appointments. Maybe it's just let's make sure that our routine stay as it is. I don't want to change anything just because I got this. So let's understand what their need is, because that is very important. And let's not go into, I want to be extra supportive or extra caring when they don't want that. Maybe they do want that. And again, that also comes with proper communication. And I think that's what we offer as well in Friends of Cancer Patient. We offer a lot of moral support. We offer peer-to-peer support, which is very important and very relevant for the patient, where we sit them together. They discuss things among each other. They ask things among each other, which usually maybe the patient is shy to ask her doctor. And usually we pair them with, let's say, a newly diagnosed patient will be paired with a survivor, for example, where first her moral and psychological well-being will be definitely enhanced because she's just diagnosed with cancer and she is sitting with a survivor. So definitely there is this, in a way, a hidden message that if she can do it, then you can do it. But at the same time, she sits with the survivor and asks all the relevant questions. Will my hair grow back? How can I have, what's my relationship with my partner going to look like? Will I still, always feel low? Will this change? And all those things that in a way she cannot ask her doctor, or even when she asks her doctor, with all the respect, their main concern is, I want you to be on the treatment. We want to fix you. We want to make sure that you are doing well and that you are cancer free. Where maybe when somebody asks, when would my hair grow after chemotherapy, which it does, the hair definitely grow after the chemotherapy. Maybe for a doctor point of view, that will not be very relevant because doctor already knows that the hair will grow and it sometimes grows much stronger. But that kind of communication needs to happen. And sometimes maybe the doctor would not be the best person to communicate that, but another woman who went through the same journey. Through Friends of Cancer Patient, we offer lots of these peer-to-peer support. We offer also, we have a hair donation drive where people just come donate their hair, and we work with partners to convert that to wigs to make sure that women, even children who are undergoing chemotherapy, do get at that point in time when they do lose their hair, they get a wig that will cover that until they have their hair back. And we offer something called Color My World. It's an amazing event and campaign initiative where we do a lot of empowerment for patients and survivors and even their families. And we speak about lots of things, different things, from how to put makeup and feel better, to how to cook healthy meals, to even how to be mindful and do, yogas and meditation to help with the mental state. So it's quite a comprehensive program, which we are very pleased, and the response rate from the patient and the community has been amazing towards it. And also we support the patient from a spiritual point of view, where before the pandemic, we used to send patients to do the Umrah and pilgrimage as well to Mecca. And I think that used to play a huge role. Inshallah, we will be resuming that whenever we have the go ahead from the authorities, because as you know, that's stopped during the pandemic. Definitely you can see the patient faces before they do it and after when they come, and you can see how their faces totally changed, and they do understand that they got that support from a spiritual level. They do have support on the physical from their doctors, the mental, the psychological from their families, and the events that we do. Look at health from a comprehensive point of view. It's a multifaceted word that needs to be addressed on each of that facets. I'm sick, let me get a disease, let me get a medication that will sort me out, and that's it. And you can take that example example, even on a simple flu, if somebody gets a flu today, usually if you ask that person, or even if I ask myself, or even if I ask you, whenever we get cold, usually we actually were stressed for a while. Either we overworked, we had lots of things to do, and suddenly we develop cold. What we do is we rush and get medication, but we never address the part where, okay, what do I need from an emotional level? What do I need from a psychological level? And what do I need to reduce that stress, which led me to that, cold or flu that I had. So this is a simple example, but does give you a lot of insight on how we should, as human beings, actually address our health concern and our health issue, but at the same time, try to look at it from all those different facets and angles and make sure that we address everything, not just the physical side.
Wow, that is incredible. I mean, the support that you are providing is so extensive. I think the word you used was comprehensive support that covers just about every aspect of what is needed. You did mention that the Friends of Cancer patients also focus on prevention and detection of cancer. So looking at a bit on the prevention side, do you have or can you share any tips with our audience on how to stay healthy to reduce our risk of developing cancer?
To be specific, of course, Friends of Cancer Patient, we have the Pink Caravan Medical Mobile Van. This is a standalone medical facility that is licensed to be a medical facility from the Ministry of Health, which is the federal governing body to license medical facilities. And we offer free access to screening to the community the whole year. Again, I would like to emphasize breast cancer doesn't happen in a certain month of the year. So that's why our services is provided the whole year long. Now, what we emphasize in the community and how we educate the community is that when it comes to breast cancer, you need to know your risk factor. Do you have high risk? I always say, if I was born a woman, then I'm in a high risk anyhow to develop breast cancer. But also know the other risk factors. Do you have family history? And of course, being woman and family history, these are risk factors that we cannot change and we cannot control. But there are other risk factors that we can change and control, which is having a healthy weight, embodying a healthy lifestyle, and of course, ensuring that you can deal with stress in a healthy way, because that's very important. And there are lots of now studies that is linking actually the increased incidence of breast cancer with stress as a environmental factor without even the link to a family history or genetic predisposition. Of course, the other thing is smoking. Smoking is very bad in general. It's funny when I say that because people come and say, and they think like shisha and e-cigarettes are not included. And I would say that's even worse. A shisha is almost 2 packs of cigarettes. If you sit with people who smokes, you are smoking as well, which is called passive smoking or secondhand smoking. I would like to recommend, if you are a woman living with a person or your partner smokes, and please try to convince him to stop that, because it's not healthy for him and definitely not healthy for you. And it does increase the risk of getting breast cancer. So learn about risk factor and try to reduce it. And as I said before, sometimes the risk factors is uncontrollable, like gender, age, family history. I cannot change any of that, but I need to look at the things I can change with my hand, which are healthy lifestyle, reducing my stress, and also the weight, exercise, all the things that we know, but most people don't actually adhere to. And it's not just for breast cancer or cancer in general, but I think this advice do apply on other diseases. I mean, heart disease, diabetes, blood pressure, all these are linked to bad lifestyle choices. And I think if we can flip that, I think we will prevent lots of unhealthy consequences.
Very good. I love those tips. Excellent. And thank you for mentioning about the different kinds of smoking, because as you said, they all can impact our health. So thank you for that.
I also agree highly in terms of the e-cigarettes, and especially nowadays with the vapes and all of that all the younger generations are getting into as well, thinking that it's not as harmful. Okay, so you have achieved so much, Dr. Sawsan, and I'm sure you have some future plans for other projects that maybe your organization is looking to start. Would you be able to share any with us? Any future plans?
I would say this is a team effort. I would like to thank my team and also the board directors who have been always supporting the work that Friends of Cancer Patient is doing. Again, it's a teamwork, and we are looking forward. I mean, we have expanded on all our 3 pillars. We have expanded on our patient support. Definitely, we have expanded on the number of cases we see every year, but also other moral support services, which is now very much famous and lots of people are looking forward to it. Even even if they are not in our database receiving financial support from Friends of Cancer Patient, there are still lots of patients who appreciate the moral support that we provide. And I think that's a service that will grow in the future. Our community awareness campaign will still continue, will expand. I believe COVID has provided us with great platforms of reaching out to the community through digital platforms, where before we had to do physical events. Now we're using, the Zooms of the world and the other platforms and providing campaigns and webinars. And I believe that's excellent because the outreach is now much bigger and wider, and even not just within UAE, but outer countries, outside UAE countries. So I think that's excellent. And again, there's lots of learning lessons that we learned during the pandemic, and I believe we'll carry on with these new practices. The other thing that also is going very well is the advocacy work that Friends of Cancer Patient does. We do a lot of advocacy work on a national, but also on a regional GCC level and on a global level. And that's through our partnership with lots of entities like us within the region and also globally. And I think that on its own, I believe during the pandemic became stronger because we have managed to share lots of best practices from UAE and also listen to what's going on outside United Arab Emirates in a way, because everybody was trying to understand what's the new norm now and how we can still keep the issue around cancer and the research and the awareness and the treatment relevant within the domain of COVID, because everybody was talking about COVID. That was the most important thing. But you know what? People were still getting cancer. They were still being diagnosed with other illnesses as well. And this is where organizations like us, not just FOCP in UAE, but also abroad, was doing extra work to say, guys, we appreciate there's COVID, people are dying. We need to do what's best for everybody, especially cancer patients as well, because people were still needed to go to the hospital. They still needed to get treated. They still needed to be screened as a community as well. So we tried to keep the conversation relevant in that era of COVID and still till now. But I think the most important thing is that there was lots of digital transformation that happened in the organization. So we managed to cater to patient needs through digital platforms, like how can they apply to the organization? They don't need to come to the entity anymore. They can do that online. I think that digital transformation, which was actually planned for the next 5 years, we had to accelerate it within, 6 or 3 months during the pandemic period. I believe that really will help accelerate and expand what Friends of Cancer Patient does for the community and the cancer patient. And of course, fundraising. That's very important because we are a self-funded organization, and the community has been very generous, sustaining the need of the cancer patient through us. And I believe that is important. And only because the community supported us, continue to support us, we managed to relay that support to the cancer patient and make sure that they are getting the proper treatment they deserve, but also the proper care that they need.
We definitely are so great for organizations such as yours. So we're looking forward to anything that you have planned for the future, because as you already mentioned, Pink Caravan was such a huge success, and it's become almost a staple, I guess now, a staple event that everyone looks forward to every year. So thank you so much for everything that you do and for answering all our questions. We've actually come to a segment of our show where we will each ask you a couple of rapid fire questions, something more generic, just to get to know you a little bit better. Are you ready to play?
Yes, go ahead.
Okay, so Dr. Sawsan, what did you want to be when you were little?
Yeah, I always ask myself that question because I've always wanted to be a doctor, which is very lame, I know, and it shows how much of a bookworm I am, but I always wanted to be a doctor. I never actually wanted to be something else. That's it. That's just, I wanted to be a doctor and I became a doctor, which is great.
Perfect. What is your favorite meal?
I'm a Cancer. My horoscope is Cancer. So for me, for any Cancerians, they love food. But I think we love food because it's not about the food itself, but because about the company. So any meal that I'm enjoying the company with, that would be my favorite meal. It's like a meal, but with a truly authentic connection. I think that would be a perfect meal.
Okay, so what is your favorite quote that you live by?
I am a person who believes that there are lots of situations in life that can benefit from many quotes, and there's lots of good quotes out there. The perfect quote that I always remember is Mark Twain quote. And he always says, a person who is a friend of a cat is always a friend of mine.
Perfect. And what is one thing you do every day, no matter how busy you are?
Meditate. I always keep time for meditation and listening to my inner self. I think that's very important. And I believe if all of us do that, even for 5 minutes, I think humanity will change.
Before we wrap up, we would like to do our segment called the Green Pill Moment. So for this, we would like to ask you, if you took the green pill to go back in time and change one thing about your journey, what would it be?
I believe that all of us still have the opportunity to take that green pill anytime we want. It is a actual real option for people to understand what and why they are here. But to be honest, if I do have that go back in time and change something, I wouldn't change anything, because if I do change one thing, I wouldn't be doing this with you right now. And I believe everything that we are put in life and we are exposed to in life just led us, the good and the bad, especially the bad, because the bad does actually divert you in a way to the path that you are supposed to be in. I had my life, when I was 18, I had my life planned. When after 25, when I graduate, what I'm going to do, how my life is going to be shaped into, everything was like planned to the dot. And you know what? None of it happened. And you know what? If I'm happy that none of it happened, because if it did happen the way I planned it, I wouldn't be here right now. And there's a nice saying. They say, man plan and God's laugh. So I believe that, sometimes just going with the flow and just appreciate that whatever happens to you, if it's good or bad, is actually pushing you and directing you to your better good and for your best.
As you said earlier, you wanted to be a doctor and you ended up being a doctor, so you wouldn't want to change that anyway. So thank you very much for sharing that.
Welcome. Thank you.
Thank you so much, Dr. Sawsan. It was so great to hear all the knowledge that you have shared with us today and all the tips and kind of the myths that you have debunked. I know that there is probably even so much more that we could talk about in regards to cancer and breast cancer in particular, but I feel like this was a great start for someone who might not know much about it. They could have a listen and get to know just the right things, the few things that they need to just follow and just book that mammogram. As you said, it's just once a year and don't postpone it. You have the time, make the time. And just before we say our final goodbye to you, I was wondering if there was any platforms that people could follow you and the organization on social media or your website that you could share with us.
Absolutely. So Friends of Cancer Patient website is www.focp.ae, and all the social media handles are actually at FOCPUAE. And we have amazing social media. We create challenges as well. So even if we advertise when are we going to do our, meetings, webinars, information, I really recommend people following Friends of Cancer Patient on our social medias platform.
Thank you very much. And honestly, what I take away from this today, from the message that you've given us, is that cancer is not a death sentence. It can be beaten and there is hope. So thank you so much for all that you do. And thank you for being here today. It was really excellent. Thank you very much. And we wish you and Friends of Cancer all the very best.
Thank you very much. It has been an honor and a pleasure. Very grateful. Thank you.
If you enjoy our conversations, please like and subscribe. See you next Wednesday.